see you all here. We're so happy and very, very excited to be working with you on the Capacity Strengthening Grant. This is very, very exciting. I will ask you to please mute yourself, and if I hear you, I will probably end up muting you from my end. So just to let you know that. So don't forget to mute yourself. All right, so here we are. I want to take a moment to share I'm going to share my slides here. Here's our slide, the first slide you just saw. All right. I want to take a moment to read the Tribal Relations Acknowledgement to you. The state of Minnesota is home to 11 federally recognized Indian tribes with elected tribal government officials. The state of Minnesota acknowledges and supports the unique status of the Minnesota tribal nations and their absolute right of existence, self-governance, and self-determination. The United States and the state of Minnesota have a unique relationship with federally recognized Indian tribes formed by the Constitution of the United States, treaties, statutes, case law, and agreements. The state of Minnesota and the Minnesota tribal governments significantly benefit from working together, learning from one another, and partnering where possible. The Minnesota Department of Health recognizes, values, and celebrates the vibrant and unique relationship between the 11 tribal nations and the state of Minnesota. MDH believes that the partnerships formed through a government-to-government relationship with the 11 tribal nations will effectively address health disparities and lead to better health outcomes for all of Minnesota. So, let's see. So here you can see the agenda for the day. We have a special guest who's going to be coming up in just a moment, and we will meet with the Kumba Collective folks and go through the different aspects of this grant. Please feel free to ask any questions or enter questions into the chat as we move along, and we will do our best to answer those questions. If any of your questions don't get answered, we will collect them and send the answers to everyone via email. Now I'm just going to do a quick introduction. The Health Equity Strategy and Innovation Division's mission is to connect, strengthen, and amplify health equity efforts with MDH and across the state of Minnesota. We see this division as a network hub, leading, connecting, and strengthening networks of health equity leaders across MDH. To strengthen, we provide leadership in advancing and cultivating health equity leaders within MDH and across Minnesota communities. The Health Equity Strategy and Innovation Division amplifies and supports the work of communities most impacted by health inequities. So here is our capacity strengthening team. I would like you all to take a moment to introduce yourselves, and how about we start with Anna, and if you could just show yourself on the screen while you introduce yourself, that would be great. If not, if you can't, I understand. Anna?
Hi, good morning, everyone. My name is Anna Borgstrom. I am the fiscal analyst on this team, at least for now. So I make sure that your funding, your award funding has been set aside specifically for you. I review your invoices as they come in and make sure they get paid in a timely fashion, and help the grant managers with any financial questions they can't answer that you ask them. So happy to be here with all of you today, and I will pass it back to Amy.
All right, how about Liz?
Thank you so much, Amy. My name is Liz Mago. I'm one of the grant managers for this program. Some of my responsibilities are to provide technical assistance during the implementation of your grants. Over to you, Amy, once again.
Thank you. And I am Amy Michael, and I am also grant manager. And I'd like to introduce Sarav Dahal, our supervisor.
Good morning, everyone. Thank you, Amy. My name is Sarav Dahal. My pronouns are he, him, his. I provide support to our grant managers working on our 4 different grant programs at our division right now. So we work with a total of about 138 grantees across the state. I would also like to welcome you, and as our new partners, I'm glad that we are meeting this morning. And even though this is a virtual meeting, I'm glad that we are sharing this space. And now that this capacity strengthening grant connects us, I would like to also invite you to share with us your stories, your best practices, and tell us to our face what we are doing wrong and what we should be doing instead. So in so many ways, we want to move away from our traditional grantor-grantee relationship model to more of a co-creator model where we are comfortable bouncing off our ideas and vision with all of you, and to kind of create the solution that works for you and the community, not for MDH. Okay, so please reach out to us, to your grant managers, and provide honest feedback on processes, improvements, solutions guided by the community input. And again, we are here to learn from you. We are learning from you more than you think. So please help us show the directions where we need to go. And with that said, I will hand it back to Amy. Thank you.
Thank you so much, Sarav. Now I'm going to turn it over to the Health Equity Strategy and Innovation Division Assistant Director, Sarah Shute, to say a few words. Sarah?
Good morning, everybody. Hi, welcome. I am so excited. I'm like going to bounce out of my chair here because I've been dreaming of this opportunity to even have this legislation for a long, long time. And so I just want to give a huge welcome on behalf of our division director, Adi Kosionu D'Souza, who cannot be here today. I know she's very excited as well. And so we share this warm welcome to you all. I want to acknowledge a few things. First, we wanted to thank the incredible team that's worked so hard to get us to today. You see them here. There are many actually that helped beyond this team, the whole grants team, and many others across our division and across MDH and in community. So thank you so much, everybody who helped get us here. I want to also say it really matters who is in this room today. I can't see you all, right? There's not a whole lot of people on camera, or my little laptop doesn't show everybody's face, but it really, really matters who is in this room today. We do not take this lightly. There are so many people who could not be in this room today too. Our funding just simply isn't enough to fund the incredible need that exists, but I wanted to kind of, I don't know if y'all know how to use those, are they emojis or the reaction buttons, but like, if you could just like try to show somehow, or at least in your mind, be with me in terms of how many people, is this your first time getting state funding? Would really love to see kind of some level. Thank you for a thumbs up. Yep, we have thumbs up, which actually is a lot. That matters greatly to us. We took that into consideration. How many of you have organizational budgets of less than $500,000? That matters a lot to us as well. We see you, we know how important that is, and that was really part of this legislation and why it matters. And then last, but certainly the most important to me, how many of you have leadership that reflects the community you serve? How many of you have staff, not just staff, but also board and leadership? Of course, the staff are awesome, but it should be almost everybody in this room. That matters so much to us. So I wanted to say this is not, this is something that we are very intentional about co-creating with you. There are so many others that could not be in this room, and we see them too, and we know they really need, you know, this has to be bigger. This is just the beginning. So I wanted to say, really, there are, you know, so many opportunities that Sarav said, please tell us what we're doing wrong. Or what we could do better together. Maybe that's a better way to frame it. But honestly, this legislation has been a dream for many years. And it's really about how do we do our grant making better, not just on the front end, but also in collaboration day to day with you all. There's so many things that I think could be improved. There are so many systems that are not working really well. And of course, systems are big and take a lot of time to change, and that's okay. We'll work on that. We know I've been at MDH for 18 years almost, and things change slower than you want, but we're going to keep getting there. And so I'm really, really just grateful to you all for your partnership, and appreciate your patience in advance as we learn together, and really hope that this funding can at least allow you all to, do some of the things that you'd been, maybe not able to do before without some of this very specific funding that is really for capacity strengthening. So just a few more points, because I do have some other points here. Just wanted to say, we went through COVID together, right? Some of us, we all went through the pandemic, and it was really, really hard. And we know that we need to do things differently there too, and just in general, and we need to be transformational in our approaches. So really, you all know what your communities need. You all know the resilience of communities, but we're here to support, and we're here to support as a system too. And so I just wanted to say again, congratulations. Thank you so much, and welcome to the Health Equity family.
Thank you, Sarah. All right, I'm just going to take a very quick moment, technology moment. I just want to show you that this is a review of the Teams ribbon that you see at the top of your screen. If you'd like to use closed captioning today for this presentation, you can click on the 3 dots, which is it says more underneath them. You can click on those dots, and it turns into the settings, and under it you can scroll down and click on the language and speech, and then click on turn on closed captions. So who is here today? What we'd like you to do is please write in the chat your name, your organization, and one interesting thing about yourself. And as we do that, and as you write your name and one interesting thing about yourself and your organization, we're going to bring on our special guest from the Minnesota Department of Economic Development, Linda Miller, to talk about the new paid leave law of 2026. And I will stop sharing my screen, Linda, and you can start sharing yours.
All right, let's see if I can do this without a lot of pain. All right.
So at the very top, next to where it says leave, there you go. I think you got it.
All right, we're just hoping it shows up. Can you see this all okay, everyone?
Not seeing it. Yes.
Yes?
Can everybody see that? Yep. Great.
All right. Well, let's see. We'll see, make this a little bit larger. So thank you, everyone. Thank you to the Health Equity Strategy and Innovation team for allowing me to take a few minutes of your time today. The Paid Family and Medical Leave Program is, as Amy said, is part of the Department of Employment and Economic Development, but it could be part of the Department of Health Equity Strategy and Innovation, because if we're doing our jobs right, if we implement this program successfully, it will improve the health and well-being of communities, and in particular the communities that you all prioritize in your work. Just some few basics about Minnesota paid leave. So this legislation was passed last spring, which will make paid family and medical leave coverage available to nearly all Minnesota employees starting in January of 2026. The law provides both job protections and partial wage replacement for individuals who are unable to work due to a qualifying condition. And we'll talk about a little of the different elements of both medical leave and family leave in a moment. And then also that the new program is being implemented by a brand new division within DEED, and I'm part of that division. We're growing. We have 6 team members so far, all on board since September. So we're all fairly new. Some of us new to, like me, new to state government, but all of us new to this program. So why paid leave? Well, there is no, the US is only one of 7 countries worldwide that doesn't already have some sort of paid family leave for workers. In this void, states have been stepping up, including Minnesota, and will be the 13th state to implement a paid leave program. States that have done so experience stronger employee retention, better health and development outcomes for children, higher labor market participation for women in particular, and greater economic security for families. So there's a lot of good reasons to do this, but it also will impact communities and employers and community organizations like yourself. So what is covered by paid leave? Well, there's 2 parts. There's medical leave and then there's family leave. And under medical leave, this is when you take time off from work to recover from your own serious medical or health condition. Family leave has multiple components, right? It's taking time away from work to bond with a new child, either through birth, adoption, or foster placement. It's caring leave. It's taking time off to care for a family member or loved one who is experiencing a health crisis or condition. Safety leave. So Minnesota is only the 4th state in the country to offer safety leave, which is leave because of a domestic abuse, sexual assault, or stalking incident, either for the worker or a member of the worker's family. And then there's active duty leave, which is to support a loved one who's been called to active duty. Now, you can qualify for up to 12 weeks of each in a given quote benefit year, which is not the same as a fiscal year or a calendar year. It starts on the first day that you might take leave and then goes for 52 weeks. So you can take up to 12 of each of these types of leave, but in a single year, a maximum of 20. So you could take 4 weeks for your own medical condition, and that would leave you up to 12 weeks of family leave. So who is covered? Well, nearly all Minnesota employers, regardless of their business size or number of employees, will be covered and participate in the program. There is one small exception, and I can talk about that, but it's essentially for seasonal workers that work for hospitality businesses, and they have to work under a certain number of hours a year, and it's a very small carve out. In terms of employees, so any employee who's earned at least 5.3% of the statewide average annual wage in the past year meets the financial qualification to apply for paid leave, and that is about $303,700 in 2023. So who's not required to participate? Independent contractors, self-employed individuals, and tribal nation employers, they can opt in, but they are not by default required to participate. And then, as I mentioned, the designated seasonal hospitality employees. All right. So what benefits do you get from paid leave? The first is that you, unlike sort of the Family Medical Leave Act, FMLA, which you might be familiar with, that's unpaid leave. The paid leave program, by definition, provides partial wage replacement when you take leave. This is going to be scaled depending upon your income level. So people who earn less money get a larger percentage of their wage replaced. And if you earn a much greater percentage of the statewide average weekly wage, then you'll be earning maybe 60%, but not 90%. And then there's a maximum of that's equal to the statewide weekly wage, which is currently about $1,337 a week. Also, you get job protection. So what this means is that an employee who has taken leave must be restored to the same position or one that's equivalent and has the same pay, status, benefits, length of service, seniority, overtime, etc. So we know that you bring multiple perspectives to this topic. So you might be employers, right, as community organizations. So this is a benefit that will now be available to your employees, and you will have to manage that in the context of your many other benefit programs that you have. But you play such an important role also as community navigators, as community connectors, and capacity strengthening organizations, because you're going to be on the front lines of helping people get access to this program. And we'll talk a little bit more about how we're going to help you do that in a minute. So these are just some of the key things as an employer, what your role is. So you have a key role in informing your workforce and in also funding the program through payroll deductions. You also support it, again, by helping employees to coordinate their benefits, such as paid time off or another state program, earned sick and safe time. And then also you're key to implementing the program, right? We need to do this. It's not a it's done in collaboration with employers, employees, and communities. So funding the program, as I mentioned, it's funded through payroll deductions. So, and there's a separate premium for the family and for the medical leave. But what you need to know is essentially employers are required to contribute a minimum of half of what that payroll percentage is, which is currently estimated, I think, at 0.7% of your payroll. But you're also able to deduct a maximum of half of that from an employee's paycheck. So just so we know, the employer premium part here is the minimum. Employers can pay more if they want. For an employee, they cannot be forced to pay more than half of the premium. All right, so as I mentioned, I mean, your organizations provide critical civic social services to communities, and especially those communities who are most likely to benefit from paid leave, but also least likely to know about it and access it, and very well might have experienced, you know, systemic displacement, systemic just disparities in the way that government programs are implemented. So we want to make sure that we are leveraging, but also giving you the funds that you need to help us implement this program. So by legislation, we are required to spend a certain percentage of the overall receipts from the program on outreach, and then a certain percentage of that is required to be granted to community organizations like your own who are willing to provide information, technical assistance, and outreach to make sure that our populations that, again, are the least likely to know about it, but most likely to benefit with the information. So we will we'll be providing some more guidance on that, but that will start in July of 2025, those grants. But also starting in January of 2026, as a small business owner, a nonprofit or for-profit, you will be eligible for both a small business assistance grant that can help you pay for a replacement worker or to up the wages of a worker who's going to be filling in for the worker employee who's needing to take leave. I also want to point out that if you are a small employer, under 30 employees, you do not have to pay the full premium. So you will only pay about half of the premium that all other employees will pay. So there is a bit of a break there for you as small employers. And again,
Linda?
Yes.
There's a question in the chat. I might have missed this, but who pays for the paid leave, the employer or the state?
Oh, that's great. The program is paid for by employers by essentially a premium. Think of it like an insurance program similar to unemployment insurance. Employers pay into the state paid leave program, and then when someone takes leave, they apply to the state, and the state will pay them for their wages, not their employer. So it's very similar to unemployment insurance, and in fact, we'll be leveraging their system to make it much easier and not duplicate the process for those of you who are already participating in unemployment insurance. But that's how it works. Essentially, they can deduct some of it from an employee's paycheck, but employers also must pay 50% of that. They pay it to the state, and then the state will pay to employees. Let's see. Is this grant not out until 2026? So the outreach grants will be made available starting in July of 2025, right? That's 6 months before the program goes into effect. The small business small employer assistance grants, they'll go into effect in January 2026 when the program goes live. So in January 2026, employees will be able to start taking leave. Employers will be able to start deducting premiums from paychecks. And also the small business assistant grants will be available for businesses who need some support for when their worker is on leave. All right, and that's ongoing. So I'll just say it's not a one-time with both the small business assistant grants and the outreach grants. That is not a one and done program. That is for the life of the program. So this, I'm hoping that given the work that you do in the community, you'll consider applying for and helping communities navigate paid leave as part of the services and community strengthening that you already do. So I want to say also that it's super important to us that we take an equitable approach to this program, and that is prioritizing the needs of communities that particularly you're serving. So we want to hear from you. You can send questions through our website. You can sign up for the paid leave newsletter, which right now is coming out about monthly, and it just gives some sort of like frequent updates about where we're at in the program. We'd also love to partner with you to co-design this grant process that we'll be implementing starting in July 2025. So that's an opportunity for you to make this program responsive to your needs and the needs of the communities that you're serving and strengthening. And so watch for some upcoming opportunities there. And finally, just reach out to me personally as the public engagement manager if you have additional questions. I know we don't have time to probably answer all your questions here, but just really appreciate the opportunity to let you know about this program and the opportunities that exist for you to get grant support to help your communities take advantage of paid leave.
There's one more question, and then we'll move on. Any idea what the cost of the premium will be per employee?
Right now, I'm not doing the math in my head, but I would say that if you figure that the current premium for the overall employer to submit would be 0.7% of their payroll, and half of that could be taken out of an employee's paycheck, just take 0.35% times your annual wage, and that's what would come out of your paycheck. And that's only if the employer chooses to charge the full 50%. Again, employers can choose to what we call top off, which is pay more than half. And we have heard from employees that they're very interested in helping their employees get full wage replacement and are looking at ways to combine benefits so that it's not just a partial wage replacement for workers. Also, I'll say that as we get a little closer, we're going to have calculators on our website that will allow you to just plug in like your salary and immediately get a sense of what will be coming out of your check. And we'll have one for employers as well.
Okay, thank you so much, Linda. Anything else you want to add before we move on?
No, just please reach out. I appreciate all that you're doing, and we want to continue to build your capacity to do the good work that you're doing for sure. And let's see, do I need to stop? There we go. I'll stop sharing and turn this back over to Amy and the team. And good luck, and thank you so much.
All right, so we have one more special guest coming. We have here with us today Kuumba Collective. We would like to introduce them. We've contracted with them to do some of the work with us, and I will pass it over to the Kuumba Collective team. And I will advance the slide.
Hello, good morning, everyone. My name is Lanice Block, and I am a representative of Kuumba Collective. Our chief mastermind, Shakira Onwachi, is not available to join us this morning. And we are here to help with the capacity building experience for the CBOs for this grant experience. At Kuumba, our mission rather, is to disrupt the status quo, redesign harmfully ineffective systems, and create transformative impact through holistic, humanistic, and healing strategy. Our intent is to establish and address the growing need for creative, out-of-the-box problem solving and address complex issues. Next slide. So as a team, you see Shakira, our principal creative mastermind. I am an associate, Lenise Block. We also have on the team Susie View, associate assistant creative mastermind, and Darius Lyles, assistant creative mastermind. And you all, Susie and Darius, if you're here, you want to come on camera and wave. We have a combined, we are collective social conscious masterminds with over 35 years of experience, combined program development, organizational development, and uplifting the community. We can go to the next slide. Our process for this, for being a part of this grant, is the Capacity Strengthening Institute Roadmap, where it's going to be mostly in 3 parts. We have an organizational assessment, which you all will be getting or have gotten very soon. It's going to be a pre and post assessment. There are 5 domains: leadership, management, operations, community, community engagement and service, and evaluation. We're going to use that to identify the opportunities for capacity building and action planning. So you're going to get the organizational assessment. You're going to go through it and see. You're going to score yourselves and see kind of where you land. And then we're going to have that information, and we're going to use that information to kind of inform the process and how we interact with you. The next phase would be the workshops. You're going to have 6 workshops that are going to take place Tuesdays from 2 to 4 from May 14th to June 18th. We're going to have an opportunity to register for those workshops. And they're really going to be designed around very specific topics to help strengthen the capacity around your engagement with your organization and with getting, securing, and successfully managing grants with MBH and then with other organizations as well. Additionally, you're going to have an opportunity to have one-on-one technical assistance with a member of our team. Each organization gets up to 6 hours, right, of technical assistance. And really what that is going to be about is whatever issues probably the wrong word, whatever topics you feel like you want to explore deeper that come up via either the organizational assessment or the or workshop series that you want to delve deeper, you want more support on, you have more questions about, you want to amplify your expertise, whatever it is you want to deal with and talk about, you can definitely bring those to the technical assistance times and sign up for those, and we can work through those with you together, provide some leadership, some support, some expertise in those areas. So that's kind of our process, our plan. We are excited to work with you all. We have been working and planning and thinking and creating for this engagement, and we are delighted and really looking forward to working with and meeting each of your organizations, and excited to be a part of them, excited to help. If you're talking, Amy, I can't hear you.
I said, thank you, Lenise. We're really excited to be working with you as well. And we really, really encourage you all to register for these workshops. I will later on today send out the link again so that you can register. You have to register for each workshop individually. You can't register for one. If you just register for one, that does not mean that you're registered for all of them. You have to do an individual registration for each of the sessions. So we're really excited to be working with Kuumba. Thank you so much. And now we will move on to talk about CSG grant basics. And I'm going to turn this over to Liz, my colleague. Liz.
Thank you very much, Amy. Once again, my name is Liz Margot. We've met with some of the grantees here. My pronouns are she and hers, and I'm one of the grant managers. Next slide. Thank you very much. So when you're looking at the CSG grant basics, before I even go into the goal, just as a reminder, the capacity strengthening grant is really hinged on 3 pillars. which is the organizational partnerships to improve health outcomes. And as you also remember, infrastructure improvements to be better equipped for success. And the last one, of course, workforce development to create a positive change. So when it comes to the goal is really to strengthen CBO's partnerships, infrastructure, and workforce to be better equipped and prepared for success in procuring grants and contracts from state organizations. It is also to address inequities for people in Minnesota who have been disproportionately impacted by health and other inequities. And in this, its reach is reaching across Minnesota, looking at the metro, rural, faith-based community organization that are serving people of color, American Indians, LGBTQIA people, and people living with disabilities in Minnesota. And we're looking at the funding for this grant. It is approximately 1.832 million in state general funds. Next slide. Thank you. So I'd like to take this opportunity for you to share in the chat how you think a grant manager can support you and your program to be successful. So as we work together, I want you to maybe consider how MDH can help you to succeed in your project. What are some of the needs we can assist you with? And please do not hesitate to share any feedback so that you can better serve you as grant managers. So we can share this in the chat. I can as well maybe just put this question on the chat so that you can contribute to it. I have placed it in the chat. Next slide, Amy. We believe, in fact, that the experts and our role is to support you to maintain and build upon your expertise. So our grant management philosophy is really to connect grantees to each other and to resources at Minnesota Department of Health and throughout the state. It is also to strengthen grantee capacity to meet grant requirements, to evaluate their programs, and to advance health equity in their communities. And the last one, in terms of our philosophy, we are really looking at amplifying grantee voices in state government and amplifying the successes and challenges of grantees to inform future public health practice. But in all this, we believe that you are the experts, and our role is really to support you to maintain and build upon your own expertise. Next slide, Amy. So when you're really looking at the landscape in terms of what do CSG grantee managers do, we have 3 issues. We do a lot of supporting, providing support, and of course, tracking and monitoring work plans, budgets, reports, and compliance. So I know that many of you are continuing to give us a response in the chat, and thank you very much for those contributions. So basically, we assist grantees with administrative and reporting requirements. We also provide here resources to help in your work. Questions such as, how much have you spent down? We actually track that, helping you to track that. Questions such as, are you unsure whether or not an activity can be paid out of CSG funds? Well, we can review that information for you. When you have questions like you'd like to revise your budget, definitely we are here to support you through the whole process. So in addition, we'd like to ensure compliance. We assist you with a lot of evaluation and performance review as well, providing technical assistance and resolve issues if you encounter those. Last but not least, we'd like to amplify your voice within the state government. So please let us know how we support you better. And in the meantime, please do not hesitate to reach either to me or Amy with questions or concerns at any time throughout this grant period. Next slide, Amy. Now, this talks about the grantee reference guide. We sent you a grantee reference guide, I think, for my grantees last week and for Amy a couple of weeks ago. This guide has been created to kind of like support you throughout this grant. It is subject to change. It is actually a living document. If there are any changes, we'll provide an updated one to you, and always find the most updated version on CSG portal, which we'll share in the coming slide. So many questions you have about this grant can be solved using the reference guide. Always refer to it. Although when in doubt, do not hesitate to actually contact either me or Amy. We also encourage you to share this grant reference guide with your financial team or other team members that you are working with within your organization. So really, please make time to really go through it thoroughly. If you have access to it, you can open it and follow along during our presentation today. Next slide, Amy. So as I indicated, we utilize our website for sharing information and resources. And this is a link to our CSG grant portal. And Sarah, thank you so much for sharing that again in the chat. So we really ask you to bookmark this grantee portal page. This page will contain the updated reference guide. It's got the invoice template, it's got fact sheets, it's got facts, answers, and questions. It's got the grant calendar, among other things. So we really plan to utilize this page extensively and updating it more often moving on. And as I indicated before, kindly share with other members in your organization that are working on this grant to make sure that we are moving in one accord. Next slide. So before I hand over to Amy, I wanted to see if you have any questions related to what I've presented on. Feel free to share on chat or maybe just ask questions here. Sarah, Amy, and I were here to answer the questions and to help you. Thank you very much. Over to you, Amy.
Thanks, Liz. Thank you so much for all the feedback in the chat. I recognize that we're not reading through those, but you can take your time to read through them as we move along. And the nice thing is that we have all of that information and things that you're looking for, and we will really take all of that to heart for sure. So I'm back now, and I'm going to go over the grant program requirements. So as grantees, you're required to comply with the requirements outlined here and in the grantee reference guide. During the year, you'll be required to participate in a number of activities, and I'm going to briefly explain what they are, and others will be talking about them as we move forward as well. So we have here the site visit. And a site visit is a meeting, usually in person, but sometimes virtual, with your grant manager to discuss topics such as progress toward your grant goals, successes, challenges, spending updates, and any financial issues in your grant-related work. It's a great time to ask questions, ask if we have any resources, all that kind of stuff. The meeting generally takes place at the grantee's main place of work, but it could take place virtually, or we've also met with people in other locations as well. And the meeting will last between 1 and 2 hours. Sometimes other MDH staff will accompany the grant managers on the site visit to get to know you and your program a little bit better. So your grant manager will contact you to set up a site visit at a time that works for you and your staff. Then there's financial reconciliation, and we're going to talk more about that later, but this is a process where a grantee's request for payment for a given period, so it could be for 1 month or 2 months, is reviewed alongside supporting documentation for that request. And examples of that are purchase orders, invoices, receipts, canceled checks, general ledger reports, bank statements, check stubs, timesheets, and payroll records. And it's not even limited to that. If the reconciliation identifies any spending, invoicing, or documentation issues, you must work with MDH to resolve them. In some cases, it could be that you may be placed on a financial monitoring plan or have to repay funds, and it all depends on the issues identified through the reconciliation. And you'll be notified 2 weeks in advance of the reconciliation date to have time to prepare for that. And Anna will be talking more about that later on in this presentation. More requirements include following your work plan and budget. The work plan can be updated anytime throughout the grant period. Just work with your grant manager to do this, and we'll talk about how to do this later. If there are major delays in implementing your work plan, for instance, please let your grant manager know. It's important to keep track of the activities in your work plan and keep it updated. You could at some point come to the realization that one of the activities in the work plan just isn't going to happen, or that it's going to change somehow. And that's okay. We get that. That's what happens. So what we need to do is make a work plan revision. And we'll talk about, like I said, how to make those revisions in a little while. Along with keeping track of the work plan, you also must keep track of your budget and keep that updated as well. Always check your budget to ensure that your monthly invoice is in line with the budget and that the items in the budget still align with your work plan activities. We know that things change and sometimes staff may leave, or you find you don't have enough money for one of your supplies. That's okay. It's okay to make changes to your budget as long as it still aligns with your work plan. And I'll be talking about making budget revisions in a little while as well. And then there's reporting. You'll be required to submit one progress report, probably about I think it's about 8 months into your grant, and then a final report. And we'll be talking about, Liz will be talking about that in a little while as well. So what are the staffing requirements for the grant? This is what we ask. Please designate one staff person to serve as the primary contact between MDH and your organization. This person should be responsive to emails from MDH, generally responding at the minimum within 2 to 3 business days. Please let your grant manager know if or when the contact or you will be out of the office for prolonged periods of time. And if possible, designate a backup contact and let your grant manager know who that will be. Contact your grant manager as soon as possible when staffing on the grant changes, such as hiring new staff, or there's a leadership change, or someone leaving the organization who was working on the grant. If the staff person change was or will be paid with grant funds, a budget modification and or a formal revision will be required. So here are some other program requirements that you may already be familiar with. Participate in virtual group meetings, which will take place either monthly or quarterly. Liz and I are going to talk a little bit more about how often they will be. If you can't make that, please ask someone else to attend and let us know. Notify us if you can't. If that's not possible, please talk with your grant manager to work out how you can receive the information that was missed. Another requirement is to prepare and submit a monthly invoice. And we also ask that you please save all of your financial documents. You do not need to submit them to us. We just want you to save them. Just a little bit about travel expenses. I want to go over some additional important information to keep in mind. Grantee staff may be reimbursed for travel expenses while traveling for grant-related activities or trainings or meetings, and that goes according to your approved budget. Many of you already have travel approved. The expenses can include mileage, parking fees, meals, and hotel accommodation in the amounts actually spent and in accordance with the Commissioner's plan. This information is on page 8 of your grantee reference guides. There are links on this slide to the IRS website and the Commissioner's plan. These links are also on page 8 in the reference guide, so you can go to them if you're interested in looking at them. So, are there any questions about grantee requirements? If you do have some questions, please feel free to put them in the chat as well. And I'm going to pass it over to Liz, who's going to talk about reporting.
Amy, this is Rob.
yes.
There is a raised hands from Pam.
Oh, okay, thank you.
I just had a quick question. Do you know when the monthly virtual meetings are going to happen so that we can put them in our calendar?
Yes, we're going to let you know about that probably sometime this week.
Okay, thank you.
Okay.
Thank you very much, Amy, for that.
Welcome.
Now I am presenting on reporting. The reporting is one of the required activities for this grant, as it was mentioned earlier by Amy. You can also find this information on page 6 of the grantee reference guide. Next slide, Amy. So basically, the reporting progress report has 2 pages. It is the work plan reporting, which is the first one, and then the narrative responses. The work plan reporting really it talks about how much progress have you made in regards to your work plan. It describes what progress you have made and challenges or barriers. On the other side, which is the narrative section, it looks at what accomplishment and highlights do you have to share with us. What are some of the sustainability issues you'd like to discuss, and what kind of support do you need from us, MDH, to make sure that you are in progress in terms of meeting your milestones? Next slide, Amy. So this is a snapshot of your progress report template and narrative section, and we'll share with you. As you can see, the progress report, as I indicated, is really derived from your work plan format, where it consists of the activity description, activity output, and timeline outcomes. And then on the extreme right columns are where you type your answers to the questions on the progress you've made towards each goal, looking at is it started, is it in progress or completed. Then, of course, we move on to description, what progress you have made towards achieving this goal. And the last one, looking at the providing challenges, barriers that you have faced, as well as how you can address those challenges. And the last section, as I had indicated, it's all about the narrative responses, where we are looking at accomplishment and sustainability issues and how we can support you as MDH. Next slide, Amy. This, you can find this again in the reference guide. It really provides an outline on the deadlines, the reporting timelines. Progress report period is from April 1, 2024 to November 30, 2024. Let's all take note of the due dates that are there. The progress report is basically due on the December 30, 2031. No, on December 31, 2024, and the final report will run from December 1, 2024 to June 30, 2025, and is due July 31, 2025. And once again, this reporting timeline is in the reference guide. Next slide. Any questions about reporting? If there are none, I would like to take this opportunity to pass this to my colleague, Anna, to talk about the invoice procedure. Over to you, Anna.
Thank you, Liz. I appreciate that. So payments and invoices procedures. Next slide, please. So we are asking that you submit invoices monthly, and I did see in the chat that that might be difficult for an organization, maybe more than one organization, and you can talk to your grant manager about maybe submitting them quarterly. But because this is such a short grant, we really want to stay on top of your expenditures. So monthly, if at all possible, would be preferred. We have provided an invoice template, which we'll review in just another couple slides here. And it's pretty straightforward. You've got categories from your budget that correspond with categories on the invoice, and you put in your expenditures for that category each month and send as a Microsoft Excel document to us via email. We do ask that your invoices be on time, and on time is the last date of the month following the month the expenditures took place. So your your invoice for April of 2024 would be due May 31st, 2024. If your grant didn't get started till later in April, you can combine April and May's invoice and submit them on June 30th. That would be all right with us. So next slide, please. So MDH has up to 30 days from the receipt of the invoice to issue payment. And obviously, the sooner you submit your invoice, the sooner you'll be reimbursed. There's a little bit of a caveat to that. It has to be an approved invoice. So if you submit an invoice and it's not signed, or you've gone over your budget on one particular category, the invoice is going to get sent back to you to be revised, either, or signed or whatever. And when we get that invoice back and approved and approve it, that's when the 30 days starts. Now, having said that, typically, if I'm paying these invoices, they're going to get reviewed and submitted for payment the day you send them in, or at the very latest the next day. So you'll never be waiting too long for us to do our part to submit your invoices for payment. Next slide, please. So this is a copy of the invoice that is on the website, also probably provided to you earlier. We do not need an electronic signature. If you are able to do a PDF digital signature, that's great, but a typed name or handwritten and scanned signature is acceptable as well. So, this shows your salary and fringe, your contractual, your travel, your supplies, and your other expenses, just like your budget did. So basically, you would just, whatever you spent in each of those categories, you put in to this invoice template. It will calculate things for you. We ask that you do enter your organizational information and contact information on the top of the invoice so that we know who to ask questions of when we get these invoices in. Next slide, please. So there's this lovely ommh@state.mn.us email that you'll send your invoices to as an attachment, preferably in Microsoft Excel. We'll review the invoice and send it to our accounts payable department. They will approve and approve the payment and send that information to the Minnesota Management and Budget Office. They are the state agency who actually makes the payment. So if you're set up for direct deposit, it will be directly deposited to your bank account. Otherwise, they will cut a check and mail it to you. MDH does have the authority to deny invoices that are more than 30 days after the agreed upon submission deadline. And again, we have 30 days from the receipt of an approved invoice at MDH to issue payment. We also have authority to deny invoice reimbursement for work that we deem unsatisfactory or performed in violation of federal, state, or local laws, ordinances, rules, or regulations, as well as costs not pre-approved or in accordance with approved work plan activities and strategies as noted in your guide. Next, please. Next slide, please. Sorry. Please note that financial transactions are on a reimbursement basis. So your reimbursement requests must correspond to the way expenses were budgeted in your most recently approved budget. For example, if you budgeted for space costs under supplies, then the expense for space costs should be listed in your supplies line. Travel line salaries and fringe in the salaries and fringe line. But things like, you know, like cell phone plans, if you, those are in your budget and you put them under other, they should always be reported under other, not under supplies or not under any other category. And like I said, MDH staff is going to review each invoice against your approved budget and expenditures to date before we approve the payment. Make sure that you're not overspending in one category or underspending in one category either. Next slide, please. So we'd like you to check your spending against your budget monthly, just to ensure that your spending is on track and that there's a plan in place to spend your entire award amount. Your grant managers are available to help support you in finding ways to spend your funding and in revising budgets and work plans as needed to maximize your funding. We do want you to take advantage of this funding in the best way possible for your organization. So we're very willing to help with that, with getting that to happen, I guess. I wanted to say that. Next slide, please. So
there is a question in the chat.
Yes.
Do we always submit our indirect costs each month at the % we indicated in the budget, despite when we actually pay the costs included in the indirect expenses? Or do we buy insurance, for example, and then bill that entire amount in that month, knowing it will be part of the indirect %?
So I would say your indirect is a percentage of your direct expenses, and the should be claimed every month. So if your direct expenses are $10,000 and your indirect is 10%, you're gonna invoice for $1,000 for that month for indirect. The indirect covers your items that are not specifically called out in your budget. So kind of like your overhead, your electricity, your water, your copier contract or whatever. So claim it every month at the percentage you put into your budget.
And then there's a comment here, and I'm just going to answer that. We will talk with you individually relate about Venmo, as you saw in the earlier chat. And it says, however, mileage for staff reimbursement to staff are sometimes paid through Venmo for speedy payment reimbursement. Totally get that. However, we really, really need you to have a mileage log so that you're keeping track of how much you're spending in your mileage and who you're spending that to. And we do have a sample mileage log that we can share with you, or we'll put on the portal so that you can see. If you have your own mileage log that you use, that's fine also, but we really want you to keep track of that specific. And it's really only, the mileage can only be for travel to and from things related to the grant, not anything additional. All right. Any other questions? All right.
Back to you, Amy.
All right. So now I'm going to move on. Thank you so much, Anna. You'll hear from her again in a little bit, I believe. So I think right now what I'd like you all to do, if you feel like it, is to either stand and stretch. And I think we should take probably, we'll stop. I could just sit here and listen to that all day long. It's so wonderful to listen to. So welcome back. Hope you all were able to stretch a little bit. Right now, I'm going to move on and talk about budget revisions. So one thing I do understand is we've been sitting here since 10. And we're going through a lot of information, and we recognize that much of it might not be remembered tomorrow. So please don't hesitate to reach out to us for any kind of guidance. You know, I know you can tell me something today and tomorrow I won't remember it. So I'm happy to help anybody with anything. So budget revisions. We're going to talk about revisions that are 10% or more of a line item in your budget. Please remember that this is not 10% of the entire budget total. It is
Amy,
yes.
you're not sharing any longer.
Oh, look at that. Really? I can see that. Come on. There we go. All right. Sorry about that. Get this off of here. There we go. All right. So getting back to what I was saying. We're just going to be talking about 10% of the entire, not the entire budget, but of just the line item. So grantees must spend funds in accordance with the negotiated itemized budget that has already been approved. If you anticipate changes that are greater than 10% of any of the approved overall budget line items, for instance, in salary and fringe, or in contractual services, or travel, or supplies, or other, we ask that you please contact your grant manager and talk to them and request a budget revision anytime the budget expenditures change significantly. So some examples of that could be having a staffing change on the grant project, having a new spending need, such as a new computer, additional supplies not already listed in the budget. If you need to remove something from the budget that will no longer be needed, such as a subcontractor or supplies for an event. So just a moment ago, I mentioned to please remember that this is not 10% of the entire budget total. It's of the line items. And I just want to point out what a line item is. So here is a picture of a sample budget, pretend totally. And so the line item that you'll see here's salary and fringe. So the line item would, if you wanted to change the executive director's salary a little bit. So you, and if it's 10% or more, so 10% of $36,800 would be $3,680. So if you wanted to pull $4,000 out of this salary and apply it to the elephant plant growing consultant, then that would be 10% more, and you would need to request a grant revision request. So I just wanted to point out it's of each line item, not the entire budget. So here's in your budget, you can always look at your summary page. It's a tab at the bottom of your budget. So let's say if you'd like to move $1,500 from salary and fringe to supplies because you had a vacancy in a grant funded position for a few weeks during a transition period and you experienced a cost savings in salary and fringe. First, what you would need to do is to check to see if the $1,500 is more than 10% of the supplies or the salary and fringe line. In the example, the total salary and fringe line is $91,020. 10% of that is $9,102, and the total supply line is $2,515, and 10% of that is $251.50. Because the $1,500 you want to move is more than 10% of the supplies line total, you must talk with your grant manager and request a budget revision before the change in spending occurs. Now, I know this sounds complicated, but it's really not, and it's really simple, and we have created well, we didn't create it. My supervisor created a really, really cool tool for you to use to make a budget revision. So we're going to check this out. So this is just an example, and I couldn't take a picture to have the whole entire thing show on this slide. And I know it's blurry, but I don't think the numbers matter all that much. So here's an example of the budget revision template. So what you can do when you want to make a change, you only make changes in columns A through H. This whole section here is your budget. In this section, you don't enter anything here. You don't write anything. It auto calculates. And I'll show you what that looks like in just a moment. So in columns I, J, and K, you don't need to add anything. And column K will show you the percentage, whether you're under 10% or over 10%. And it's so cool because it auto calculates. And also, if you're scared to do this, or it looks difficult, just give us a ring and we'll help you out with it. So here's what it looks like. If you look at the green, the one that is highlighted in green, like I said, you only make changes here in columns A through H. So let's say the executive director decided that she wanted to increase the pay for the financial consultant. So she decided she was going to lower her salary and take $7,500 from her salary and apply it to the financial consultant's salary. So if you look at the blue section here, this one, blue one, you can see what happens when those changes are made. She subtracted the $7,500 from the amount that was in here, from the $3,700, $37,500. It's so blurry, I can't really see it. And you can see it shows up here. The change made in column H for the executive directory's salary is just the difference that pops up, and it comes out in red. And then if you move over it and look in column K, you can see it shows that it's 12.4%. So it's higher than 10%. So this would be a change that you'd need to talk to your grant manager and request a budget change for that. Let's see. Then when you want to add the $7,500 to the $10,000, you would enter the number down here into the contractual services. You would enter $17,500, and then you can see that $7,500 that you're over here comes in here, and then your budget will be balanced. Let's see. So like I said, reach out to us if you have any questions about this. I know it's really hard to sort of see on this and to get the idea of how it works, but it's really quite a cool tool. We sent you a copy of your budget revision template, and we ask that you save a copy, and then each time you want to, if and when you want to make a budget revision, save it and rename it so that you always have that template available to use each time you want to make a revision if you need to. All right, so here are just the step-by-step instructions. Step 1, save a copy of the approved budget revision template. Then what you do is you rename the budget template. When you rename it, always include the date of the revision. And I just put a sample here so you can see what the naming convention that works for me would be. It says budgetrevision.csg.xyz, which is the name of the organization, and then the date, 4/23/24. Make your changes only, I know I keep saying this, but only in columns A through H in the budget section, and then check column K to see whether the change is 10% or greater. I'll ask somebody to admit because thank you. And then step 5, save a copy of the renamed revised budget and send a copy of the budget revision along with an explanation or justification of the request to your grant manager. So not only do you need to make the budget revision, but you want to tell us why what's going on and why you're making those changes. You would send it just as it is on the slide in the example. And you might want to say something like, the financial consultant needs more time to complete the activities in the work. We underestimated the amount of time it would take, so we took salary away from the executive director and applied it to the financial consultant. That's the type of explanation that we're looking for. In this case, you would also need, in this case, you would also need to make a minor revision to your work plan timeline, or maybe you wouldn't, but if you're removing or eliminating positions or changing anything, you want to go back to your work plan and make sure it's aligned. So you might need to do that. In this case, I don't think you would need to, because the positions are staying the same and it's just the finances, but in other situations you might need to. Of course, if your grant manager has any questions, we'll reach out to you, and once the revised budget is approved, and only when it's approved, you can then start using the new budget. So up until your grant manager makes that approval of the budget revision request, you still need to use your the original budget. When the change to the budget is less than 10% of the line items, then you don't need to make a request. You don't have to request a budget revision. You can still call us and ask for help on how to do it, but you just follow the same steps that I just outlined. You save the revised budget with a new name and date it, and send that to your grant manager with an explanation. Whenever you make budget changes, whether they're greater or less than 10%, please review your work plan to make sure it is all aligned with the budget. And here's a little important point. Grantees must notify grant managers of any and all budget modifications to ensure your budget in your MDH grant file is always up to date and aligns with your spending and your work plan. Because if it doesn't and you don't tell us, then we're going to be out of sync and we're going to have to go back and figure out what happened here. So always let us know so that we can keep everything balanced. For work plan revisions, grantees must request a work plan revision. Actually, you don't need to request one, but you do need to talk to your grant manager about it. And that is if an activity is changing and is no longer consistent with your most recently approved work plan, or if you'd like to add or remove an activity. You need to request the revision. Talk to your grant manager, explain what's going on, tell us why you want to make these changes. To request a work plan revision, you would make the proposed changes to a copy of your most recently approved work plan. You would rename the revised version with revised and the date. And then to make the changes, you underline any new text. So you use the same copy of your work plan or the copy of it, but you keep your text there. You don't delete anything. You just add things and you underline it, and then items that you don't want anymore or you're changing, you put a cross through. And I'm going to show you an example. Once you've made the changes, email a copy of the proposed work plan to your grant manager with a brief description and a justification for the change in the body of the email. And then your grant manager will review your proposed changes and get back to you with any questions or requests for revisions. Usually, I mean, it says we have written here generally within 5 business days. Hopefully, it's a little bit sooner than that. So here's an example of what a revision looks like. You can see in this example, you can see the changes in the description section. You can see that the 5 is crossed out because they're changing it to 2 board listening sessions. In the activity output section, you can see they added 2 listening sessions held in June 2024 and crossed out 5 listening sessions held in July 2024. And then in the timeline, they added June, changed it to June instead of July 24 and crossed that out. And key staff is still the same, but if there were a change, you'd cross one out and add the new key staff.
Hey, Amy, this is Anna.
Yes.
I just wanted to make a note. I put it in the chat as well. Do not use track changes in Word to make these corrections or make these
Right.
changes, because when you accept the changes, all of the old stuff disappears. And we need to see what was there, and we need to see what you're adding. So use the strike through and the underline to make the changes. Don't use track changes.
Right. Chances are, if you did that, I would have to send you a new copy of your old budget revision, work plan revision, and have you redo it so that it doesn't disappear. We just like to see what the changes are. And when you think about it logically, it makes sense. Thank you so much for mentioning that. And as always, if you need assistance, I know we keep repeating this, we're here, please reach out to us. So anything that has been approved on your budget is, we'll talk about what's allowable and unallowable. Anything that is already approved on your budget is allowable. It's already been approved. Unallowable costs or expenditures for which grant funds cannot be used. NBH has the authority to disallow expenditures not pre-approved. MDH staff review invoices, and we reserve the right to question or take action on inappropriate uses of funds. Unallowable uses of grant funds include, but are not limited to, the following, and you can see what they are: direct service programs, fundraising, any individual piece of equipment that costs more than $5,000, cash assistance paid directly to individuals to meet their personal or family needs, capital improvements, ongoing medical care or treatment of disease or disability, bad debts, late payment fees, finance charges, or contingency funds, taxes, except sales tax on goods and services, lobbying, lobbyists, or political contributions. And there's more information about this in your grantee reference guide on page 10 and 11, and certainly talk with your grant manager anytime. We're here to answer your questions. So things that need prior approval, the following items require prior approval before a contract is signed or an expense is incurred. So if it isn't already approved, MDH has the authority to deny the items requiring prior approval. So contractual service, if you decide you need to contract with somebody else or somebody in addition, you need to talk to us about that. Equipment and electronics over $3,000. Out-of-state travel, promotional materials, stipends if they're not already approved. If you already have been approved for these items, you will not need prior approval. However, if you're adding any of these items, like I just said, to your work plan and budget, you will need to get prior approval. And there's more information on that on page 10 and 11 in the grantee reference guide. Any questions? All right. Well, certainly, if you have some questions, put them into the chat. But now I'm going to pass it over to Anna to talk about financial reconciliation.
So I think, was it Claudia has her hand raised? Go ahead, Claudia.
Thank you. Yes. My question is, say I have a quantity of 8 of something and I only use 6, do 6. Can the 6, so, and the total amount is $200 and I use 6. Can I divide that $200 up among the 6, or does that need to be moved somewhere else, or how would that work? Did that make sense? Probably not, but.
Well, I think so. If you, let's say you have stipends, then you're paying people to do some sort of service for you, and you were going to give out 8 of them, and you're only giving out 6. Does that make sense?
Yep.
Can you, if you know that you're not going to need to use all 8 of them, and that's what you have in your budget, then you want to do a budget revision. So if you say, okay, we only used 6 of the stipends. We only sent a check to 6 people. It was going to be 8, and we have some funding left over. Then you just want to do a budget revision. If it's more than 10%, you need to check with me. If it's less than 10%, you can just go ahead and do it and let us know. Let me know.
Okay.
Did that answer your question?
Not completely, but we're on track.
Okay.
Can I divide the remainder up between the 6? Say I was going to give everybody $25, and now I'm only going to do 6, and these numbers probably won't add up. So I was going to give everybody $20. Can I now give them $35 instead of? Does that?
I suspect whatever works within your budget. If you're not going over your line item, you can do it however you want.
Okay.
Obviously you don't want to just give the whole $200 to one person, because that's not what you indicated in your work plan. But yes, absolutely. That's entirely up to you. You just really need to make sure that you don't overspend.
Right.
Takes me a little while, but eventually it sinks in. It goes in slowly. Any other questions?
There's one more hand raised.
I see a hand up.
So I do have a question regarding the budget. So I have 2 contractors, and both of them, like, they're usually what they would do the project, and then I have to pay them based on that specific project that they worked on. And I know this is something that we have to do monthly. And so I was just wondering, like, how would you go from there if I want to revise the budget? And should I just do a one-time invoice for them for the whole amount? Should I not do it? Like, I don't know if the question is correct, but I don't know. I'm just mumbling at this point. But that was my question.
So you're going to hire a contractor, and you want to know if you can pay them the full amount at the start before they finish their work.
So they would be finishing the project, but we have to pay them. That's how they have been requesting. So we have to pay them for them to continue working on it. So, and they will be working on the project because they cannot complete all of it. It's a web developers, and so they will work on it, but we have to pay them fully.
Well, I think that would be fine. However, we call it contractual services, because then we have a contract. So you'd have a document that they would sign saying that they're going to complete such and such and such and such, whatever they're supposed to do in a certain amount of time, so that you have that paper contract. And yes, I understand that some contractors won't do anything without getting paid up front. So that would be just fine. Ideally, it would be great to wait until they finished, and some contractors are willing to do that, but you have to work with what you've got. So
okay, perfect. We will just put that paper together. Thank you guys so much.
And make sure you get a signed copy from each of them. Yes, Mary?
Just for my clarification, it is okay to pay them in full. A contractor.
If that is what they are saying, we're not going to work for you unless you pay us in full. It's been my experience, and I'm talking about contractors that have worked on my house, that if you pay them in full and they don't finish the job, you're out of luck. So sometimes you can do a negotiation and say, okay, we'll pay you half at the beginning, and then we'll pay you the rest at the end when you complete the project. That's called a negotiation. Doesn't have to be half. It's just whatever you would work out with them. But we did not do that with a contractor, and we ended up having to go to small claims court with this person because they didn't complete what they said they were going to do at all. So that's just something to keep in mind.
Thank you.
I would also piggyback on what Amy is mentioning, especially payment around contractors, right? Because again, they are saying something that they would perform on your behalf, but eventually it doesn't get done. We get into issues. So a lot of time it may also be viable for you to kind of chunk those out in terms of, like, let's say you identify a deliverable to be met the first month or second month, and then you pay for that deliverable and then do the same thing for that second round. So it is also possible to do that if they are in agreement. So see what fits with your agency. If they do require upfront payment, that is okay. But at the same time, if they are nowhere to be found in Amy's situation, then we will be in trouble, right? So however it's going to work, and that's where having those receipts and making sure that, how you are paying them is also going to be very, very important. And that's why I was even saying that, if you make a contract, a payment through Venmo, would there be a way for you to retrieve that payment? Possibly not, right? So how do we best safeguard ourselves as well as our funding to ensure that we do get those deliverables addressed as well as met on time? So those were all the reasons. So thank you so much.
And I think what I'll do, and I can't guarantee, but I'm going to look for some sample contracts that we can put in that I could supply for you as a resource, so you can see what a contract might look like. That's why we asked for specifics in that work plan. I know we were driving you nuts during the negotiation because we kept saying you need to, break it down. You need to break it down, and that's exactly what Saurav is referring to. So, you have it all listed, and that's the list is what you could put on the contract and when that person's going to get paid, if that's how you want to do it. All right. I see a hand up, but I don't. Yeah.
Yeah, go ahead. Cynthia, I think. Yeah.
Hi, everyone. My question is related to independent contractor as well. What is your preference when it comes to paying? For example, we're paying that independent contractor through two different ones. One is from this one and through another grant that we have received. Will it be easier for the independent contractor to just do contract just based on the amount that is payable through this grant to make it easier for you? Or do we just submit the entire invoice and their contract for the total amount, and then just let you know that this grant is only going to pay for, like, say, 2,000 of that total amount? That
is a great question, and I really appreciate it. I think what you should do is what works for you. So if you decide to pay them in the lump sum, then you need to itemize that on the invoice or whatever it's called, and say this was paid from CSG funds and this was paid from XYZ funds. Or you can do it separately. It's entirely up to you.
Okay, sounds good. Thanks, Amy.
Mm-hmm. All right, let's move on now to financial reconciliation, and I will hand it over to Anna, and I will just flip to the next slide. There we go.
Thank you. So Amy alluded to this earlier, that during the grant period, there will be a financial reconciliation requested of your organization. State policy requires us to do at least one financial reconciliation for grant awards between $50,000 and $250,000. Since this is somewhat of a shorter grant period, you only have about 15 months total. We probably won't do more than one, but we might if the first one proves problematic. So it's not an audit, okay? We're not going to come in and demand to see all of your books and everything. What we're going to do is we're going to ask you for specific documentation related to probably 1 month of expenses, and it's going to be a month of expenses that's we've already paid for, and it's going to be like, we're going to ask you in August for something to support documentation for your May invoice. So it's going to be something that's already taken place, and you've been reimbursed for those expenses. What we are going to be asking you for is a source document and proof of payment for all of the expenses you listed on that invoice. Okay, so a purchase order, an invoice, and those are good source documents. Receipts, canceled checks, general ledger reports, bank statements, check stubs. Those are all good proof of payment documents. Timesheets are pretty much a mandatory thing, because if you are being funded by more than just MDH funds, we need to see you know, this employee worked 5 hours this week on the MDH grant. They may have worked the other 35 for other programs or other grant funding, under other grant funding. We need to see how much they worked for this grant program. So a timesheet indicating, you know, how many hours were worked for this under this grant program is a very good thing to have on file. If you're only getting funding from MDH, then I'm sorry, I'm hearing the echo. There must be somebody that's not muted. Okay. If, you know, you can just state that, you know, MDH is your only funding source at this time, and all hours worked are for under this grant. If when we conduct the reconciliation, it identifies any spending, invoicing, or documentation in issues, sorry, we're going to work with you to resolve them. Amy mentioned earlier that you might be placed on financial monitoring plan or have to repay funds depending on the issues we identified. We hope it doesn't get to that point. We hope that you save all of your expense documentation for every month of the grant, and that we can, you know, you'll have them at the ready and can just submit them to us for us to review and make sure that everything is above board and on track to, you know, regarding the expenses for that month. If so, like I said, it's not an audit, it's just a check. We want to check that you're keeping the documentation. We want to make sure that the documentation is sufficient to provide us enough information that shows why you requested the expense, so your source document and how you paid them, your check or your general ledger report, and, you know, make sure that you do that for the entire grant period, because in case you are audited, that's what you're going to need to show the auditor. They're going to ask for those types of documentation. And as an MDH or as a state grantee, the office of, we have an internal auditor at MDH that could ask to audit you at any time. And the state has an auditor that could ask to audit you at any time, because you are receiving state funds for this grant program. So we just want to make sure that this is our check to help you in case that audit ever happens, just to make sure that you're keeping the right types of documentation and that you can provide it to us when asked. So back to the Venmo thing. If you have a way to show what you're using Venmo for, if you have some sort of a report that you can run or something like that, then maybe Venmo might be okay. But in my experience with Venmo, that's not something that they readily provide. And you know, I don't use it that often, so I'm not an expert or anything, but that's why, you know, that type of payment is a little bit not that it's not accepted, but it's a little harder to prove. And we want you to be able to prove that you've made these payments. That's all I had to say about that. But if there are any questions, I can certainly try and answer them. I don't think a screenshot is sufficient, because a screenshot of a Venmo payment is not, you know, we don't know who Anna Borgstrom -52 is, we don't have a list of, Venmo usernames. We don't know who you are, so I think, if Venmo is one of the main ways that you reimburse people or pay things, you need to talk with your grant manager and figure out some way to document that. Anybody have any more questions?
Yes, I have a question. I'm Yunju Park from the Korean Adoptees Ministry Center about this financial reconciliation. What kind of a time frame are you giving us?
Yep, so we will send you at least 2 weeks in advance a request for the documentation for one invoice period. So if I'm going to ask for your invoice, your documentation for August, I probably wouldn't ask for it until probably October. So, beginning of October, I'd send you a request for your August documentation and give you 2 weeks to get it back to me.
Thank you.
Mm-hmm.
So my little tip to y'all, not that I'm any great expert, is being organized, not letting things go and then you have to go backtrack. Backtracking is the worst to have to do. So if you spend something or you have an invoice for something, file it immediately when you're thinking about it. Just get yourself into the habit of doing that so that you're not having to go back, because going back, it takes time and can be very, very frustrating. Any other questions related to anything, not just necessarily financial reconciliation? Yes, Claudia.
Do you need original receipts, or can it be a photocopy or a snapshot, or what are you looking for when you want your documents?
Right. It can be a photocopy or a snapshot or, a picture you take with your phone, as long as it has information on it that states, like if it's a receipt, we need to be able to see who you paid, how much you paid, and if there's a source document that goes along with that, what you paid, why you paid this person that amount of money or this entity that amount of money. But yeah, photocopies and pictures are fine.
I see another hand raised. Can't tell who it's for.
Hi,
I'm gonna just stop sharing.
Jason Johnson, can you hear me okay?
Yep.
Okay. My question is, it looks like you want the invoices sent back via Excel, but I'm only finding the PDF copy. Is there a link to the Excel version, or can it be sent to us via email so we can save it as a default?
I'm gonna let you answer that, Amy, because I did not provide the invoice.
Yeah. It's a fillable PDF form, so you should be able to fill it where it needs to be filled. So it shouldn't be an issue. The only thing that I noticed is that the signature part, because the form that we sent you does ask for an electronic signature, and I'm not sure if there's a way to bypass that. So we'll have to take a look at it, and if it can't be bypassed, we'll just change it up and send you a new form.
Right.
So the form you want to send is a PDF and not an Excel.
Right, it's a PDF.
We had asked them earlier to send it in Excel.
Right, but then we changed our format and created a PDF that's fillable, and I think that's the preference that I was told we should use.
Either way is fine. PDF, it also auto calculates, on your side. But if you come across any issues, let us know so we can send you that Excel spreadsheet as well for the invoicing. Yeah. But either way, it should be totally fine.
Excel would be great only because I'm in there now and the electronic signature doesn't let you type it in on the PDF version.
Right. I noticed that because I was playing around with it, sampling it. So if we create a new form, that doesn't have that electronic signature. I think Saurav is a master at that, so he probably can figure out how to get rid of that. I'll send you a new PDF version of it. If not, just send us the Excel version, and that would be just fine too. Any other questions?
I think there was a good question in the chat, and I can't remember exactly how it is, but if we're using a fiscal agent, do we send our invoices to the fiscal agent and they report it to you all, or do we send it directly to you? And you send the funds back to the fiscal agent?
Right. So that's between you and your fiscal agent. If they are comfortable with you sending it to us directly, that's fine. If they feel like they have to review it and want to send it to us, that's fine as well. The payment will go to the fiscal agent, regardless of who sends it in.
Thank you, Anna. I also noticed Mary might have had her hand raised.
I
Or
did.
maybe
Just
not.
want to make sure we get copies of all the slides and all the forms and PDFs that we need to submit, just so that we're on track. Because I'm like, I want to make sure we do it right, right? So thank you.
Correct. Yes, you'll definitely get copies. We also have our portal that I think we'll be able to utilize, and you'll find a lot of information there as well. So yes, you'll definitely get slides. I'm not going to guarantee you're not going to probably get them tomorrow, but you will get them sometime soon.
Yeah, and I cannot thank you guys enough for putting this together, because it helped. So I was nervous about this, and seeing this and the steps and the procedures and your leniency to work with us too, your flexibility has been enlightening. Thank you.
Yeah, and what I would also mention to that, Mary, is we are going over these rules and guidance to set up your expectations and also delineate some of the responsibilities as a grantee, right? And also know that there are rules, right, that we have to play by as a grants manager. And they are important because we are working with state funds. The transparency part is very much preferred. We really want to be transparent with our processes as well. And this will be the same thing if you were to, let's say, work with other grant programs, let's say with DEED or DHS or MDH for that matter, right? So what we are trying to do with this capacity strengthening grant is we are trying to invest in our partnership, right? So that you become the catalyst to change within your organization, whether it's from the equity side of things or from partnership, as well as improving your own capacity and be the champion of your community, right? Because when we read your applications, the proposals and what you're trying to do and all the, I wouldn't say unsuccessful applications that you have made to the state, so those dedication and commitment towards the community that you serve really inspire us all. And I have no doubt that moving forward with this grant as being one of those mechanisms, we'll be able to achieve remarkable things. So thank you so much for being here. Thank you so much for asking important questions, and just keep telling us what we need to do better, okay?
Well, you're doing a great job, because you hear so many things about the state. Some just sound scary, and some people discourage you to apply, right? Because it's a state grant, and you're just gonna mess up and get in trouble. And so we decided to go for it. And as of today, it has been one of the best decisions we took, right? So not just being selected, but this whole process right here, right now, and Amy's support. I mean, thank you for your patience and being there. I just want to say thank you.
Yeah, Mary, thank you so much for saying that, because that's what our team is really, really working on hard. And change doesn't happen fast, but we're working on it. I think there was one more hand, Claudia, and then we're right at 12. Yes.
Right. I'm sorry. This is to confirm what Mary said. I was told the same thing. You're not going to get it. They don't know who you are, and you're new, and you're not gonna probably won't get it.
Yep.
So
that's
thank
what
you.
this is all about. Yep. Well, thank you for mentioning that. That really is wonderful to hear. We're really excited to be working with all of you. Really thrilled on all of this. And as I say, always reach out. No question is a dumb question. I make mistakes all the time. I don't know a lot of stuff. Trust me, I don't. So we'll work things out together. And I have this amazing supervisor, Sarav, who is so helpful and wonderful. So we're gonna get through it, and it's gonna be a great year. Thank you so much all for coming and sitting through this 2-hour presentation. We'll get the slides out to you, or the PowerPoint out to you when we're ready with it, and certainly reach out. And have a great rest of the day.
Thank you.
Thank you.
All right, thank you.
Thank you.
Thank you.
Bye, everybody.
So long.